Hi, my name is Angela Tinder and I'm a student at the University of Buffalo Graduate School of Social Work. I'm here today with a presentation called The End of Big Brother, Rethinking the Role of Mandated Reporters in a Trauma-Informed Child Welfare System. So psychological trauma can be defined as any event that causes feelings of helplessness and fear to the degree that it overwhelms the system's ability to cope. And we know that families that work with child welfare services often have long-standing histories of chronic and complex traumatization. Psychological trauma in all of its forms is increasingly being recognized as the basis of psychopathology and by extension as the basis of maladaptive parenting behaviors that can bring families to the attention of child welfare services. And research clearly supports this link. The higher the incidence of trauma in a parent's life, the more long-standing and chronic or toxic the trauma, the more likely that parent is to have behaviors that will cause child welfare involvement. So the problem that I want to talk with you about today is not about the problems in the parents' behaviors, but the problems in the child welfare system that can actually exacerbate the impact of trauma on vulnerable families. We know from research that interactions with the child welfare system can be harmful for service users. And Bulkley in 2011 interviewed child welfare service users to find out about their perceptions of their work with the child welfare system. He found that child welfare caseworkers were stereotyped as hostile and powerful people to be avoided, and that there's a significant amount of shame and stigma associated with using child welfare services. We also know that historical trauma can impact the way that families look at social institutions, including child welfare services, and that some entire cultural groups can develop a great distrust for child welfare because of historical trauma. So what is most interesting, though, about this research from a trauma-informed perspective is that it doesn't necessarily require an incident of trauma for something to become a chronic stressor that exacerbates traumatic symptoms. And what I mean by that is that simply the presence of the constant threat of harm, not even a concrete incident of harm, but the presence of the constant threat of harm from a system that is perceived as dangerous, can become a chronic stressor that reduces families' ability to cope and to have healthy adaptations following trauma. And that's what I'm talking about with the child welfare system, that the perception of service users is that the system is a constant threat. And that perception is fueled in part by mandated reporting and the almost army of mandated reporters that are bound by law to provide surveillance and to report on any suspicion of child abuse and neglect. So the solution to this problem is a trauma-informed child welfare system. And this is truly an idea whose time has come. If you look at the University of Buffalo website for the Institute on Trauma and Trauma-Informed Care, you'll see that in 2016, in February of 2016, 8 different states had pending legislation to build more trauma-informed service delivery systems. And in New York State, in February of 2015, the Office of Children and Family Services released the new child welfare practice model. And on that model, developing a trauma-informed system is listed as a practice that's consistent with OCFS values, and the Office of Children and Family Services promised to prioritize their resources in such a way to realize these practices. So I put on the PowerPoint for you the section of social services law that I'm primarily concerned with. It's New York State Social Services Law, Section 413, that lists the professions that are mandated reporters, and they're mandated to report at this standard: reasonable cause to suspect. I counted, I believe there's 51 different professional categories that are mandated reporters in New York State. Social Services Law Section 422 goes on to say that any disclosure of information about a report shall not identify or provide any information that could identify the source of the report. So some historical context here. Mandatory reporting does have its origins in U.S. law, drafted in the 1960s. There was a doctor, Dr. Henry Kemp, and his colleagues discovered a syndrome, battered child syndrome, And mandated reporting laws were really based on public health laws that required reporting of infectious disease. By 1967, all 50 states had mandated reporter laws, and in 1974, the federal government passed the Child Abuse Prevention and Treatment Act that requires all states to have mandated reporter systems to receive federal funds. In 1975, the Department of Education commissioned a report to look at the status of mandated reporting in the United States, and this is where we see the first concern about the overreach of the mandated reporter system. In time, we realized we were creating a system of reporting which could invade and harm the lives of parents and children as easily as it could help them. So the question I have for you today, the question I'm going to ask and the question I'm going to answer is, does mandated reporting make children safe? Mandated reporting is such an ingrained part of child welfare services in the United States that we assume that it's necessary. You may be surprised to learn that many developed nations do not have mandated reporting laws. And in a review of international child welfare systems in 2007, Wallace and Bunting found mandated reporter laws are not associated with a reduce in child abuse and maltreatment. They're also not associated with a reduction in child abuse related deaths. The one outcome consistently found with mandated reporter laws is an increase in reports to child welfare services. But I ask you to consider, is an increase in reports necessarily a positive outcome? In 1977, professionals in the United States reported 3 out of every 100 children to child welfare authorities. By 2003, 15 out of every 100 children were reported to child welfare authorities by mandated reporters. So although the United States has a long established history of mandated reporting, in 2003, the U.S. still had the highest incidence of child abuse deaths per capita in the wealthy world, according to UNICEF data. The same data shows that of the 5 wealthy countries with the lowest child abuse death rates, 4 of the 5 do not have mandated reporting laws. And in the last 20 years, the 5-fold increase in child abuse reports has not been associated with any decrease in child abuse deaths in the United States. Even with the huge increase in mandated reporter reports, we know that between 50 and 60% of cases of suspected child abuse still go unreported by mandated reporters. Mandated reporters report that they have a fear that making a report will disrupt the therapeutic relationship. They fear that CPS interventions will not be helpful. They may harm the family. And they believe that sometimes resources other than CPS could be a better help for the family. I propose to you that whatever the reason mandated reporters fail to make reports, ultimately we know they fail to make reports because they do not believe that the benefit of the report outweighs the potential costs of making the report. They don't believe that the benefits outweigh the burdens 50 to 60% of the time. So my proposal today, consistent with the original intent of mandatory reporting, we should modify New York State Social Services Law, Section 413, to drastically reduce the number of professions mandated to report. We'll then allow other agencies and professional networks the freedom to write their own policies regarding the types of suspicions and circumstances that need to be reported to CPS. This change in the legislation will directly and immediately decrease families' fear of engaging in community-based services, and it will restore the respect for the value of confidentiality in helping relationships. It will also empower families and community helpers by giving them the freedom to work collaboratively to make plans that keep children safe and meet children's needs. And it will end the perception that child safety is only the responsibility of child welfare services. I further propose that we modify New York State Social Services Law, Section 422, to remove the expectation of confidentiality for professional reporters. They'll increase transparency and trustworthiness in the child welfare system and make professional helpers responsible for addressing child welfare concerns with the families they serve. It's also going to give families the information they need to make truly informed consent regarding the providers and the services they allow in their homes.